Hi, my name is Cassie Calloway, and I wrote my paper on the overtreatment in dental offices. Just to explain the topic, it's been for years now, it's been very common for dental practices to be accused of overtreating their patients in order to make a bigger profit from either them, the patients themselves, or their insurance companies of which they go through. It is a requirement, just like any other practice, for dental offices to follow a code of ethics in order to ensure the best service and quality of their patients and make them feel aware and comfortable of their treatment that they're getting and the procedures that will be done in order to best complete their treatment. The most important thing for healthcare workers, no matter if it's in a hospital or a dental office, is that their top priority is the quality of their patients, and that they be honest, trustworthy, and have the patient's best intentions when treating them. And like I said, unfortunately, there is many dentists that either do not treat their patient's teeth the correct way or treat it as little as possible, so that when they come in again needing pain, the treatment that should have been done before could have just been like a filling, which is just could be a little anesthetic, and just put a composite material in, but instead they waited too long, so now this has turned into a root canal or crown. So the treatment went from being between $100 and $300 for a filling to now needing a root canal or crown, which is a couple $1,000s by the time the treatment is finished. I decided to choose this topic because I am majoring in dental hygiene here at Deltech, and I just think it's important for people to be aware, and also myself when I start looking for a job, or I am in a job right now in a dental office, to just be aware of my surroundings and know what to look for if I feel like something is going wrong, patients aren't being treated right, and what should occur. The ethical issues I addressed in this topic were the non-maleficence, the justice, veracity, beneficence, and autonomy. Justice comes in because everything should be about the fairness, whether it be in fees, treatments, what's considered emergencies, so that nothing progresses to making patients spend more money or them causing pain. The next one is the autonomy, and that is to make sure that patients are aware to what is going to happen on the specific procedure that they need. You don't want to start a procedure on a patient who's in the dental chair and then afterwards them have no idea what happened or what to look for if they are starting to have pain. That can become dangerous and also put the dental office in a possible lawsuit because they weren't explained of what is going to occur. The next ethical topic is non-maleficence. This is where no matter what, the dentist's priority is to protect the patient and not cause them any harm. And meaning, like I said before, if the dentist did as little as possible, like if they needed a root canal and they only did a filling just so that the patient would come back in for another office fee charge or for another procedure, this could cause the patient harm, because if an infection occurs, the patient can get an abscess, which could lead into the bloodstream, swelling of eyes, anything, which could cause more harm than good and could lead to the patient being in real danger. The next ethical issue is beneficence, and this is where it is the dentist's job, no matter what the cost is, or if this procedure is going to be covered by the insurance, or if the patient themselves can pay for it. It should not matter. It should be the dentist's priority to do whatever services needed to help the patient. And unfortunately, this is a problem sometimes, because some offices, some practices, when they have dentists who work, all they're working for is the profit of this. So if they needed the procedure and couldn't pay for it, they're going to try to push it off so before they get their money, which is very wrong. It should be the patient's health the first priority, and then the bill or the fee later. Ethics applies in just the main, like, ethics applies overall because it's just right to know that when a patient comes in, they should feel comfortable and be able to trust that the doctor is putting their health as top priority and not worrying on whether or not, if they can't pay, then they're not going to get the right treatment, or if they only have a certain amount of money, then they're going to get the lowest treatment as possible. Whatever is needed to be done in order to save their teeth and ultimately, like, keep their health good is what should occur. One reason, or the reason why I chose this topic and what I did learn, is that no matter who people say they are, at the end of the day, sometimes money can get in the way. So a dentist can twist the truth or not do as much as they can, knowing that in the long run they'll have a better profit if they wait. Also, I've learned, even when working in a dental office, because I'm very fortunate that none of my dentists that I work for are like this. It's priority. Patient priority always comes first. And that is one thing I've learned just being a dental assistant, and that what I can take as being a hygienist is you build relationships with patients who come into the office regularly every 6 months. Or if you're doing a big procedure, you might see a patient 2 to 3 times a month just for one procedure. You build relationships. They build trust with you. They trust that you have their health, and helping them is your top priority. And this is what I've learned throughout researching this topic, is that that's not the case for all dental offices, and that's what I think one thing should change. Code of ethics needs to be followed, and not only for the law, but for people's, like, mindset. They should feel wrong for doing this to people, knowing that it could harm them in the long run. Thank you.